Hello, everyone. My name is John Moore, and welcome to this Chilmark Research webinar, Lessons from COVID-19. Just quickly, first, thanks for coming. And secondly, before we get started, I just wanted to let you know, for those that do not know us, Chilmark Research is an industry analyst firm founded by myself 13 years ago, with the express purpose of helping organizations adopt IT to improve the delivery of care. We firmly believe that there is a very important role that IT can play in improving care delivery and ultimately the patient experience. And through our research, we hope to educate the market as to how technology is being deployed and used in that capacity. So it's always been our mission to help educate the public and educate the market. And this webinar is another case in that. And what we've done here is really reached out to a number of the vendors to ask them, okay, with COVID, what have you learned from your clients? And what have you seen that we can all learn from going forward? As many of you probably know, the pandemic, while it has subsided somewhat, we've begun opening the economy, it's by no means over. This particular virus doesn't seem to respect what usually happens with viruses, and that's go to sleep during the summer. This one seems to not care about what temperature it's at. It is continuing to thrive, and we're seeing actually some alarming rises in case counts in warmer parts of the country, i.e. Florida, Arizona, and Texas. So we're far from done in this, so hopefully what we learn here today on this call will be something that we can apply directly going forward to improve our care delivery, particularly with regards to this pandemic and what I would hope to be longer term from a public health perspective in terms of how we as a nation can respond to future health crises such as these and actually improve that delivery of care. So this format for the webinar is going to be very conversational, is what I am really striving for. We certainly have prepared some questions in advance that we've shared with the participants, and that are joining us on this call. Those are representing 3 national EHR vendors: Allscripts, Athena Health, and Cerner. And Paul Bryant at Athena Health is their CTO. At Allscripts, we have the Salman, who is their CMIO, and we have the CMO, Chief Medical Officer, Dr. Liu from Cerner. So we have a really great lineup. And I think it's a nice mix in that we have kind of a technology focused person in Paul Bryant. And then we have the other 2, which are come from more of a clinical background, both being in the practice. Well, I don't believe Salman's practicing physician today, but Dr. Liu still practices. But they come from a clinical background. So we really were looking for active audience participation. So I encourage you to use the chat feature in Zoom to put your questions forward, and then we can go from there. So without further ado, what I'm going to do is just go through alphabetically and have each of the representatives, the panel participants that we have here today, speak a little bit about themselves, who they represent, and what they've seen across their client base with regards to COVID-19. So first we'll start with Allscripts, and Salman, please.
Hey, thank you, John. Thank you for putting together this conversation. It helps to sort of get out of everyone's own sort of worlds and, interface with folks from different organizations. So I'm really Excited to sort of meet with Paul and Dr. D'Souza on this panel. Look forward to the conversation. Um, some of the things that I'm going to talk about represent what you already outlined, that this pandemic has affected the healthcare systems across the world globally. Knowing that the healthcare services industry is so diverse within the U.S., you've got single providers working in practice in rural areas or urban areas, over to multi-state health systems, which have data sharing agreements already in place or connectivity in place. Everyone is reacting to this pandemic differently. Everyone is reacting to this pandemic because it's real. There are different things that are happening all over the weeks as we've sort of gone from March 14th, when the national emergency was declared, up until now. We've seen different hotspots as a lot of our clients are centered in the New York area, in Long Island, in Manhattan, Bronx, Brooklyn. We saw a lot of activity there. So what I thought of what I could focus on was, what does the COVID-19 pandemic look like almost 2 months, 3 months in now, right? So uh, in a sense, we took some representative data from 3 different facilities across 3 different regions, and these represent, a range of Allscripts hospital users. And this is a week-by-week comparison of what is happening as a result of COVID. A lot of what CMS was driving initially was, hey, let's cancel all of the elective procedures. And that caused a lot of the downstream impact for financial recovery. So one of the things that I want to talk about is, COVID-19 has had a huge financial impact on the industry, on the health systems themselves. What are they starting to see? What are they starting to do now, 3 months in, with all of the testing in place, with a lot of the PPE and ventilator supplies back in a healthier spot? We're starting to see that health systems across, and you can see it in the top graph, are starting to open up again to their active surgical procedures. So we're starting to see that that volume is starting to get rescheduled. Hopefully that brings enough financial security back into the system so they can start to open up the rest of the services as safely as possible. So again, we're just starting out saying we're trying to track across all different regions and geographies what is happening at our client base, both in terms of surgical visits, clinical visits, inpatient encounters, ED length of stays. So we're trying to help our clients with information that gets generated. If you go to the next slide, I think one of the key tenets that we've had early on in our organization is that we are working with healthcare systems that are immediately impacted by this lockdown that has been put in place to prevent infection from getting completely out of hand. Now, as we are in the middle of June, almost all of our health systems are looking at financial recovery as the first stage. What are we doing as an organization? We, up until now, have had a task force within our organization. We have multiple products across EHRs, non-EHRs, patient engagement, et cetera. So I'm part of the task force where we're taking recommendations that come out of the CDC, come out of FEMA, come out of the other international agencies like WHO. We continue to update our product advisories so people can consume them. But as we get more and more into some of these areas, we're starting to see that hospitals want to have a way of opening up which is safe for their patients, safe for their clinicians. And that means in a lot of cases, there's very high level of interest in use of telehealth and virtual technologies. And I think we're starting to see a return to the new normal in some of the areas which weren't too terribly impacted by COVID-19. There's still a sense of active COVID-19 recovery and response in some of the metropolitan areas. So if you go to the next slide, John, you would see that Allscripts has a fairly diverse portfolio. So we provide solutions and services ranging from care coordination, which allows health systems to share COVID-19 plans with their community teams in order to follow up on patients who've been discharged from the hospital. We've got our HIE solutions through DB Motion, where we have created specific COVID dashboards where health systems can see patients who had either been treated or were tested for COVID-19, even though they may not be using the same EHR. We've been seeing a lot of Follow My Health usage, which is our virtual telehealth solution within Allscripts in terms of both virtual visits that are done over the phone or through video visits. We have a large chunk of the EHRs or a large range of EHRs across small, rural, critical access hospitals to large multiple facility IDNs, where we've done majority of work to provide COVID-19 related workflows, but a lot of focus has been on analytics related to that. And we're also working with our long-term care facilities through the CarePort solutions to help with the dissemination of information from hospitals to these acute care, long-term acute care facilities as well. So there's a range of solutions. In a nutshell, I think we have been fairly organized in terms of responding through this central task force, which consumes information from clients, knowledge resources. We've created a mechanism to delivering information and services out to our users. And we're actually seeing quite a bit of good feedback from them. And Reaction Data did a survey mid-April, late April, and asked 261 participants, mostly physicians, nurses, and CEOs from health systems. Most of them gave us a very favorable rating in terms of how we had engaged with them, continued to engage with them, and provide them solutions and services. So that's in a nutshell my starting commentary. I know I may have taken too much time, so I apologize if I did that, but we'll be here to answer some questions.
Okay, Paul, you're up next.
Thanks, John. So I'm the Chief Product Officer at Athena Health, and I'm a lifelong and career healthcare IT person. And one of the things that I always talk to folks about when they're thinking about joining the healthcare industry is, hey, the good news is healthcare is recession-proof. The bad news is healthcare is not pandemic-proof, as you saw from the previous slides. So it's been quite an interesting journey for us and our clients. I think back to January, late January, we put out our very first product enhancement for COVID, which was a set of screeners and order sets. And when we did it, frankly, I hoped that it was something that would never get used. And it seems like that was a decade ago almost. And since then, obviously, the crisis hit. We had the most immediate impacts where we saw telehealth volume on our network go up by about 35 times. It's just amazing. Frankly, telehealth wasn't a big part of the way care was delivered across the Athena network. A couple thousand visits per day. To see that go up to 140, 150,000 was pretty amazing all at once. And the other part of the crisis that was immediate was calls for clients for us not to release software, which is not generally what clients ask for. They're always asking for lots of stuff. And we are a true SaaS business, so we really only have one version of our software for everybody. And we had actually went through a process of a poll with our clients, because we had a bunch of clients who were like, hey, how about those features? And a bunch of clients were like, hey, we're struggling with the front lines of the crisis, and we don't want to impose any change on our providers whatsoever. So we elected for the first time ever to delay the release, not because it wasn't done, we just didn't turn it on. And we pushed it off to this July. So big initial interruption. Of course, you saw some of the charts about deferral of services and decline in services. Pretty amazing across the network. We service practices ranging from one physician practices up to some of the biggest practices in the country, and across the country, it's all this just collapse in well visits and elective surgeries, which I totally expected that. What I didn't expect was the decline in emergency room visits. And what's even more interesting, and I'll show you a slide a little on the rebound in a second, but as we've watched the recovery of services, emergency room visits are lagging the recovery across the Athena network. And first you're like, okay, how is that? And I think in some respects it is people truly too scared to go to the ER for things they should be going to the ER for. We saw some unfortunate data early on about people that were essentially dying in their homes because they had a stroke or heart attack and didn't call the EMTs fast enough. So that's obviously not good. But I think also what's happening as we recover is that the reality is a lot of emergency room visits shouldn't be done in the emergency room, and maybe we're kind of figuring that out. So maybe there's some hope in that. But it is bad to note that 60% of people that are high risk and should be maintained across the Athena network haven't been seen since March. So there's a lot to be done. We spent a whole bunch of time early on in the crisis writing notes to patients saying, please don't come. Now we're writing a lot of notes to patients saying, please come. So it's been kind of an interesting, both sides of the patient experience messaging piece. So we're really trying to work with our providers to bring back patients into their offices or onto telehealth or into their cars, whatever the most appropriate care delivery model is, but to re-engage with their patients. The other thing that happened was we did a whole lot of data mining. One of the cool things about being a SaaS business is that we have all the data real time, and we partner with a variety of different organizations to try to learn about COVID. And I think in the end, I'm not sure that we contributed, frankly, any earth-shattering piece of information about COVID. We did a lot of analysis of where high-risk people are. Did a lot of analysis on drugs that people are on, just maintenance medications, ACE inhibitors, all the antimalarials, anything that someone was on, and to see if we could find any kind of correlations. And that what we learned was that research is really hard to do, as well as not really finding anything that meaningful. But we did a lot of work on that and learned a lot about how to do clinical trials in the wild. And then as we think about the rebound, obviously, getting the financial piece of healthcare back, getting the care delivery options open is cool. I think on the telehealth side, people are thinking, hey, is this going to be finally the day for telehealth? And is telehealth going to become part of a more permanent and more pervasive part of healthcare? And I think the answer to that is definitely yes. We had many physicians who'd never done a video visit have now done one, and that gets the creative juices flowing. Obviously, it was helped by the fact that payers decided to pay 100% for telehealth visits, and we'll see what that happens there. But I think telehealth will certainly be, and virtual visits in general, will become a bigger part of healthcare. I don't know how big a part. I watch every week telehealth usage decline. It goes down about 8% a week. It's down to about 15 times what it was before, so still way up, but a very interesting arc and trajectory. So if you look at the next slide, this is just a state-by-state view. Since we've got so many practices across the country, we look at how the states are doing, and every state seems to have its own story. I'm talking to you from Massachusetts, where we've been extremely conservative about our reopening. And you can see it's in light green there, but that's only this last week. Before that, it was actually more of a pink color, closer to red, where the procedures were down less than 50% of the normal that they were prior to the crisis. So this is kind of an indexed view across, and you can see the states opening. You can see kind of the middle of the country is getting on opening, and actually is doing more procedures than they were before the COVID crisis, as the kind of pent-up demand is out there. We've got clients with thousands and thousands of elective procedures in their backlog that they're working through. And we're looking at this state by state just to understand what's happening. Obviously, John mentioned some hot spots in Arizona and Texas and Florida. It'll be interesting to see over the coming weeks how that volume changes and whether that impacts healthcare. So it's been certainly an unprecedented time, and one that I think we can all humbly learn from, and hopefully not have to repeat again in our lifetimes.
Thank you, Paul.
Right.
Dr. Liu, please.
Hey, yeah, I really appreciate the perspective that was given here. I think a lot of our paths were similar throughout this process. I would focus for my in a little bit of a way, which is, what we found through this is that trust is so important. And maintaining a trusting relationship with our clients was really crucial and really essential for us to be able to move fast through this pandemic. So Cerner's journey through COVID response so far was luckily very early on for us, because we are a global health company. We have been watching COVID very closely since the first outbreak in China, and really saw that acceleration through mid-January. And our teams in Australia, Asia, Europe had to respond a lot faster than responses were done here in the US. So we had been supporting this effort for a bit longer, and hoping that it wouldn't get to the level that it did here, but also being able to harness a lot of those lessons learned from those teams and help our clients here in the United States surge through that. So very early on, we stood up 2 task forces internally in taking care of our associates, who moved to a virtual world very fast. And that was very important for us to maintain continuity of business for our clients, ensuring that everybody's safe and healthy so that we can continue to. And that process, you know, as you can imagine, changed very frequently. We updated our recommendations as fast as the CDC did and continued to move through that process very fast in the early days until we completely virtualized 27,000 plus workforce across the globe. And we learned a lot through that process. And we learned that we can do this really well virtually. I think a lot of companies have taken that lesson as well. And so the second task force that we stood up was really focused on our client work, and we actually branched it into segments so that we could simultaneously work through the process of responding to COVID and helping our clients be prepared from a technological, from an operational and search capacity perspective. We also created a team that was already very early on focused on recovery, what that was going to entail, knowing that, you know, financial recovery was going to be very important for our client base and that they were going to take a very significant impact. And we also have a team really focused on reimagining what that future could look like for us in the future, hoping that this process also, you know, really teaches us how to deliver care better in a more economical way and have a better reach to our patient population. So that was really our process, and it started back in January. And the relationships that I want to bring up here are really important for us to be able to move fast, because really it's through that partnership with our client base that we are able to test things very quickly out in the real world, harness all of their experiences, just like our colleagues here on the call. We had clients all over the globe in hotspots. So the surges happened in waves and very differently across the states here in the US. And so we were able to really help our clients connect and learn from one another very fast, test our solutions, and have very rapid cycle iterations. I think that one of the biggest takeaways for us as a healthcare industry, you know, as a whole, is really that different care delivery models that we have been very resistant to adapting to work. They are effective, and they do provide, you know, a safe way for our patients to seek care. And of course, with that, most people think about telehealth, but also increasing the adoption of care at a distance or virtualized monitoring and caring for our patients, which will also help offset not just the resourcing that hospitals need to take care of patients, but also the cost of that care. So we are excited about this acceleration and adoption of technology, and really hope that, you know, as a country, we'll continue to embrace those changes and incorporate a lot of those into our new future as we reimagine what that could look like. And then the other aspect that I wanted to bring up that hasn't been talked about here is really the concept of interoperability and how important that has played a role in this response. You know, just imagine 5-10 years ago, before we started to get connected, you know, I am a physician, I'm a practicing pediatrician, I am a patient, I have family members. I truly believe to the core, as we do at Cerner, that the data belongs to the patient, and I should be able to take that with me anywhere I go. That dream hasn't been completely realized. We know that we can connect, but it's still extremely difficult for patients to get their data as they move across this country. And so highlighting the fact that if we didn't have interoperability, this whole response would have been so much harder for us all, but also you know, it magnified the lingering issues that we have today with interoperability, and the fact that we need to continue as an industry to collaborate and be more open to create a better care environment for our patients. You're on mute, my friend.
You're on mute, John.
Happens every time.
How many Zoom meetings have I had and I still end up getting caught up in that? Anyway, thank you everyone for your comments to lead off this discussion. Let me remind attendees once again that hopefully you've used Zoom in the past, and down at the bottom there's a feature called chat, and please use that to ask questions of the panelists. Just go there, click the chat function, and you should be able to ask a question. And we will take those questions as they come, because as I said at the beginning of this webinar, we really want this to be a conversational webinar between those who we've brought together here on this webinar for everyone to really be able to go right at it and get their inputs. So we did prepare some questions in advance, so I'm going to start with those. I guess, what I would like to ask everyone, kind of once the COVID-19 surge started in the US, what surprised you most with, what really surprised you in terms of what you were seeing in terms of how the industry was responding and providers were responding to this growing crisis? Someone, why don't you start off, and then I'll let you.
All right, go ahead, Dr.
Or Dr. Lou. Go ahead. I'm sorry, I'm so sad.
Please come.
But please, Dr. Lou, why don't you start? And then I'll have Salman and then Paul finish up on that. Okay?
Yeah, I will bring two aspects to this. One is the positive, and one is the not so positive, that we could do much better as a country by